I'm Dr. DiGrassie from Mountain View Equine Hospital, and this morning we're going to talk a little bit about giving oral medications to your horse. First off, we're going to start off with a different kind of medications. Not every pill that you have to give to your horse is easily dissolvable. Some are very easy to dissolve in water, such as SMZs. As you can see kind of in the syringe, it takes but a couple seconds. The pills dissolve, nice and easy. It's very easy to give to the horse in the mouth either with a syringe or you can put it in their food. However, some of your other medications, such as chloramphenicol, takes a little bit longer for it to dissolve. So usually it's a better idea to dissolve it right after you give the last dose. Dissolve the next dose for the next time you have to treat. So that way by the time you treat again, those pills are dissolved in your syringe. But there are other medications, such as doxycycline and pentoxyphenylene, that don't really dissolve at all in water, and those actually need to be ground up. Your options for grinding these pills because of their coating are either you can use a mortar and pestle, such as seen here, or you can go to the Walmart and buy a little coffee grinder and grind your medication up, put it in your syringe or put it on their food so they eat. Big thing to remember that when you grind these pills up, make sure you wash between every time you actually give the medication to make sure that there's not medication that's still sticking in here the next time. Because if you switch from Bute to a different type of drug or vice versa, you really don't want your horse getting just remnants of those other drugs in there because you never know what's been in there before. To actually give the medication, what's easy to do is either, like I said, you can either dissolve it or grind it up and put it in their food. However, a lot of horses won't eat medication this way, and you really need to make sure the horse gets the medication. So other options are actually to take a syringe, a catheter-tipped syringe, and dissolve them in that or stick them in that with water. If you don't have a catheter-tipped syringe and you have a regular syringe, you can actually cut the end off the syringe, make sure there's no jagged edges, and you can actually put the medication in there and squirt that directly in the horse's mouth. I have actually heard of people that have also used old Bute tubes and old oral paste tubes to actually give medications as well, and that's perfectly fine. If you need to sweeten it up because your horse doesn't like the taste of the medication, then you can try things such as honey or pancake syrup. They're cheap, easy to buy. You don't actually have to buy Mrs. Buttersworth, but you can buy just a generic pancake syrup, and that's a really great way to sweeten up the medication so the horse will want to take it. Some people also use applesauce, and that's perfectly acceptable as well. Next, we're going to go to the horse, and I'm actually going to show you how to give the medication. To give oral medications to the horse, a willing participant is always helpful to have, but sometimes we always don't get that. The best way to do it is just take your medication and kind of slowly stick it inside their mouth. If you need to, you can stick your finger in there first to get their mouth to open. Stick it back in as far as you can. Dispense the medication, and then I normally let the horse hold its head up in the air so that way it'll swallow the medication. Once you feel like they've swallowed most of it, you can let their head down, give them a good pat, and let them know they did a good job. Good job, buddy. And that's your tip of the day, straight from the horse's mouth.